All right, this section of the training covers aerosol transmissible diseases exposure control plan for a medical facility. So if you're a medical facility, you are operating in California, this is a requirement for you, and this is what you should be watching and implementing in your facilities. So we're going to start with the history behind aerosol transmissible diseases, then we'll get to the definition of what these things are, as well as how you implement this plan in your facility and what are the requirements based on your level of involvement as far as treatment of these types of diseases. So the first thing is the history. Well, this started back in 1991 with the TB standards, and TB stands for tuberculosis, which happens to be an aerosol transmissible disease. But at that time, the focus was just on tuberculosis, and so Cal OSHA started to require employers to test their employees, and then after a while, they decided that this was going to be too much of a burden to employers, so they decided to not really regulate this. And now what they're doing is just using it as a guideline until late 2009, where the Department of Health, as well as Cal OSHA and Center for Disease Control and Prevention came together and decided to start a new standard called aerosol transmissible diseases. And this new standard was mostly prompted because of all these novel flus that you've probably heard of, such as H1N1, SARS. I'm sure you've heard of these. And these are transmissible diseases from the air. So if you're looking at your notes, you're going to see these two tables. And these two tables, one, it says aerosol transmissible diseases transmissible by droplet. And the other one, it says transmissible by airborne solids. And each one of those have some examples of those diseases, and you can see them. If you're looking at them, you'll notice SARS, pneumonia, parvosis, B19, mumps, pertussis or whooping cough, meningitis, diphtheria, and so on under transmissible by droplet. And then you also see table 2 are things like avian flu, anthrax, smallpox, seasonal flu, novel H1N1 flu, and of course shingles is a big one. Chickenpox, measles, and tuberculosis are listed under transmissible by airborne solid. And if you were to know which one of these two types of diseases in the tables, which table actually requires more precautions on the side of the provider, you will notice that it's the second table, and that's the airborne IDs, what we call airborne solids. And you are required to have more precautions, such as a particular room called AIIR, or aerosol infection isolation room. You have to make sure that you have the negative pressure in those rooms, as well as HEPA filters and so on and so forth. And a lot more precaution as far as protective equipment. Certainly have to be wearing respirator masks such as N100s or N95s, and so on and so forth. So this particular standard came to light when we had an article in a newspaper that we read regarding a particular incident that happened in Oakland, California, and this made the news. Alto Bates Hospital was cited and fined $101,000 and change for a particular situation where a police officer had done a welfare call on a resident, and I believe it was a 36-year-old man who happened to have a viral meningitis. And when they called the paramedics, they transported the gentleman to Alto Bates Hospital. A 47-year-old nurse, male nurse in the hospital emergency room, contracted the disease and ended up in ICU. And also the police officer that made the original call also contracted the disease. And every one of these agencies were fined, including the fire department, believe it or not, by Cal OSHA. Matter of fact, Oakland Police was fined $33,000 and change for all the different things that they should have done, such as training, such as providing proper protective equipment, such as having written plans and protocols in place on what to do when a patient is potential ATD risk, and they didn't have some of those things. The only agency that didn't get so much fine, which was like I think a couple of $1,000s, was the actual fire department, because they had those things in place and there were just a few things lacking there. But this made the news, and you can actually look up the article. This was the first big fine imposed by Cal OSHA, And this is basically started or launched this whole program. And so what is it that you have to do as a medical facility in order to be compliant with this standard? The first thing you need to do is decide what category of a facility you are. If you're looking at your notes, and you'll see also on the screen, these are the types of categories that we have. The first one is called a treating facility. A treating facility is actually exactly that, is a facility that treats aerosol transmissible diseases. And this would be like an emergency room hospital or hospital emergency room. This would be maybe an internal medicine doctor or infectious disease specialist or pulmonary specialist or somebody who actually treats all of these types of diseases like meningitis and TB and so on and so forth. You also need to have a second type of category called referring facilities. And these facilities are simply where you would go to try to find out what's wrong as a patient if you're having some symptoms, mostly flu-like symptoms, which is what starts out. All of these are starting out as a flu-like type of symptoms, such as nausea, vomiting, fever, chills, cold night sweats, sudden loss of weight, more than 5 pounds without any explanation, achy body, fatigue, things like that. So if you're having any type of symptoms like that, or if a patient has these types of symptoms, who do they go to find out what's going on? Well, they'll probably go to their primary physician's office. Or if they're really feeling bad, they might go to the emergency room in a hospital. But a primary physician is a perfect example of a referring facility. So this physician will evaluate this patient. Of course, they have to take precautions and make sure that none of the staff is going to contract any of these diseases. So they have to protect themselves. And those types of facilities must have respirator masks. Again, I gave 2 examples, N95s and N100s that are made by 3M, but there are other ones out there. They have to be fit tested for these respirator masks, as well as making sure that they have certain other things, which we're going to cover in a minute. But those are the minimum things. Then that facility is going to refer them to a specialist or maybe directly to the hospital emergency room. So the third facility classification is called conditionally exempt facility. And this is a facility that usually doesn't see patients for ATDs, or if the patient has some flu-like symptoms, they're not going to go see this particular physician. These are usually specialists that don't deal with aerosol transmissible diseases, such as a neurologist or a cardiologist, or maybe a plastic surgeon. Now, if you are a dermatologist or you are a pediatrician, you are going to deal with some aerosol transmissible diseases such as chickenpox or shingles and things like that. So you have to determine whether you're going to fall under a referring facility, a treating facility, or a conditionally exempt. A dentist, for example, would be purely a conditionally exempt facility. So these facilities basically are exempt from this standard for the most part, except when they encounter a patient that comes in with flu-like symptoms. And if a patient walks in and they have a fever and chills and they're coughing up blood, or they're having some other symptoms such as achy body, cold sweat, they've lost weight for no apparent reason, those kind of symptoms are all indicative of an aerosol transmissible disease. Now, if it's the seasonal flu type of a thing, then you have to determine whether it's just a seasonal flu or not. But it's always best to be safe than sorry. So what I recommend is, if you see a patient walk through your doors with those types of symptoms, have them go and check themselves out. Certainly refer them back to their own physician, or ask them to go to the emergency room and get checked out and make sure that everything's fine before you actually start treating them for whatever they came in for. So you do need to have access to the screening questionnaire, which I already mentioned is available online at cdc.gov. We also have it available in our records manual, and it's entitled ATD Screening Questionnaire. So be familiar with that. Hand out 1 copy to each and every one of your staff, including appointment schedulers as well as clinical staff. Now, the fourth classification is simply a medical lab. If you are a medical laboratory, then there's certain things that you have to do, and these are all written in your written plans. So I would refer you back to your written plans that has been provided to you, and read this section under medical laboratories. And again, you need to follow all the different requirements when it comes to being a medical laboratory. Now, at the same time, you have still the obligation of having a written plan, which we've provided to you already. And you also have to have your review of the written plan annually, and so on and so forth. Then the last section, which is basically a classification called zoonotic facility, and this is simply a facility that has to deal with animals, such as animal hospitals, animal shelters, and so forth. So now, if you go to the next section on your notes, you're going to notice that we're going to give you some options. So certainly, as a conditionally exempt facility, you're going to screen the patient and turn them away back to their primary physician or to the emergency room. If you are a referring facility, you're going to screen for ATDs and only treat certain patients with droplet precautions. And certainly if you are a treating facility, you can screen a patient again for ATDs and treat all identified and suspected ATD patients. And of course, these are the choices that you have. Every single one of these facilities classifications must have written plans. So we have provided you with your aerosol transmissible diseases exposure control plan, and it's basically the largest chapter in your safety manual. So make sure you have a good look at that and make sure that all employees review this particular plan, and maybe you have a safety meeting on it as well. Also, make sure that you cover your cough signs in your facility. And if you are in a particular ethnic area geographically, you also have to have that particular sign in that language. So whether it's Spanish or maybe Chinese or Korean or Vietnamese or whatever happens to be the demographics of your area. Again, these signs can be downloaded from the Center for Disease Control's website. Again, that site is cdc.gov. You can see this on your screen. Then, of course, the other things you have to do is provide face masks for patients that walk in that are coughing. Or it could also be the companion of the patient. Let's say a husband and wife are coming in. The wife is your patient, but the husband is the one who's coughing. And you can gently ask them to either wear a mask if they want to remain seated in the waiting area, or they can step outside and wait for his wife to be done, and you can let them know that you'll let them know when the patient is done. The other thing is that if you are going to bring a patient inside from the waiting area who's displaying flu-like symptoms, especially a cough, you want to ask them to put on a mask before they walk into your facility, and certainly the person who's going to screen them should be wearing proper protective equipment, at the least a face mask, and keep a good distance of at least 3 to 4 feet away from that person while they're questioning them. As soon as you determine this is a high-risk patient that you should not be treating, you immediately can refer them to their primary physician, or if they can't get there themselves or need an ambulance, you can call an ambulance and have them transported to the emergency room. Another couple of things that we recommend that you have in your waiting area is certainly a hand sanitizer. But always keep it on the reception counter, because if you put it on a table in the waiting area, they have a tendency to walk out the door. So definitely want to keep an eye on it, because some people think it's just free for all and they take it. Also a box of Kleenex and maybe a wastebasket, a small wastebasket. Don't put a big, large wastebasket in waiting area, because patients tend to think they can throw their lunch in there as well and get it all filled up quickly. So get a small trash can with a foot pedal, hands-free trash can that patients can drop their masks and or any type of Kleenex tissue or something that they used in the waiting area. The last thing you have to do is make sure that every one of your staff who's going to be doing the screening is trained on the screening questionnaires. And certainly you can do this again over the phone before the patient comes in. Hopefully you catch that before that. And that's when you notice a patient is displaying flu-like symptoms over the phone. You feel like they're sick. And that's a great time to ask those questions to make sure that it's even safe for them to come in. And certainly anyone who's going to be doing it in the office. Also remember that if you're a full-fledged treating facility, such as an urgent care clinic or emergency room in a hospital, you need to have what's called an AIIR, and that's again called the aerosol infection isolation room. And this is a special room that has a negative pressure HEPA filter in there, and as well as it's designated it's almost like a quarantine, if you may, for patients that are highly contagious with an aerosol transmissible disease, such as meningitis would be a great example of that. And certainly all staff that come in must be trained on how to handle a patient like that. All staff who will be handling a patient must have protective equipment, such as the N95s or N100s, and they have to be fit tested for these, as well as making sure that they have annual reviews and safety meetings. Also, they have to have very specific protocol on what they're supposed to do with the patient, written protocols. So again, a lot more requirements for treating facilities than any other. Okay, with that said, this concludes our session called Aerosol Transmissible Diseases Exposure Control Plan for a Medical Facility. Thank you for listening.